Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're covering a problem that's robbing millions of men of quality sleep and quality of life: nighttime urination or nocturia. If you're waking up 2, 3, 4, or more times every night to urinate, you know the devastating impact. Your sleep is fragmented, your energy is depleted, your mood suffers, and your health deteriorates from chronic sleep deprivation. What if I told you there's a simple 30-second bedtime ritual based on ancient wisdom and validated by modern research that can dramatically reduce or even eliminate nighttime bathroom trips? No medications, no side effects, no expensive treatments. Just 30 seconds before bed that could transform your sleep and your life. Before we dive into the exact technique, let me share Frank's story. At 68, this retired firefighter from Seattle was at his breaking point. I was waking up 5 to 6 times every night to urinate, he told me, exhaustion evident in his eyes. I'd go to bed at 10 p.m., and by 11 I'd be up. Then midnight, then 1:30 a.m., then 3 a.m., then 4:30 a.m., and finally I'd give up trying to sleep around 6 a.m. I was getting maybe 4 hours of broken sleep total. I was exhausted all day, falling asleep at my desk, irritable with my wife, and my health was suffering. My blood pressure was up, I was gaining weight, and I felt 10 years older than I was. Frank had tried everything: reducing evening fluids, eliminating caffeine and alcohol, medications including tamsulosin and tolterodine, with minimal improvement. His urologist had diagnosed benign prostatic hyperplasia and overactive bladder, prescribed the standard treatments, but Frank was still waking up 5 to 6 times nightly. Then I taught Frank a simple 30-second bedtime ritual that combines acupressure, pelvic floor engagement, and strategic positioning. I was skeptical that something so simple could work when medications hadn't, Frank admitted, but I was desperate, so I committed to doing it every single night. Within 3 nights, Frank noticed a change. He woke up 4 times instead of 5 to 6. Within 1 week, he was consistently down to 3 times per night. Within 2 weeks, he was waking up twice, and occasionally just once. After 1 month, Frank was consistently waking up once or twice per night, getting 6 to 7 hours of sleep with only 1 or 2 brief interruptions. It sounds impossible that a 30-second ritual could make this much difference, he said, but it absolutely did. My sleep quality improved dramatically, my energy returned, my mood improved, and my wife says I'm back to my old self. The science behind nighttime urination. Let me explain the science behind nighttime urination so you understand why this ritual works. Nocturia, defined as waking 2 or more times per night to urinate, affects up to 70% of men over 60. Research published in the Journal of Urology has documented the profound negative impacts, including severely impaired sleep quality and quantity, increased risk of falls and fractures from nighttime trips to the bathroom, daytime fatigue and decreased cognitive function, increased risk of depression and reduced quality of life, and increased mortality risk, with studies showing that frequent nocturia is associated with higher death rates even after adjusting for other health factors. The causes of nocturia are multiple and often overlapping. In men, common causes include benign prostatic hyperplasia causing incomplete bladder emptying, overactive bladder with involuntary bladder contractions, nocturnal polyuria, where the body produces excessive urine at night, and sleep disorders, including sleep apnea that cause frequent awakenings, with bladder sensations then prompting urination. Additionally, chronic conditions, including diabetes, heart failure, and kidney disease, contribute to nocturia. The key insight is that nocturia often results from a combination of bladder factors, including storage capacity and sensitivity, prostate factors, including size and obstruction, hormonal factors, including lack of antidiuretic hormone at night, and sleep factors, including arousal threshold and sleep quality. The 30-second bedtime ritual I'm about to teach you addresses multiple of these factors simultaneously, which is why it's so effective when single interventions often fail. The 30-second bedtime ritual. Exact technique. Let me teach you the precise 30-second bedtime ritual that stopped Frank's nighttime urination. This ritual consists of 3 components performed sequentially, taking approximately 30 seconds total, done immediately before lying down to sleep. Component 1 is acupressure at the Sanyinjiao point, taking 10 seconds. Sanyinjiao, located on the inner leg, 4 finger widths above your inner ankle bone, just behind the tibia, is one of the most powerful points in traditional Chinese medicine for urinary function, bladder control, and sleep quality. This point is called the 3-yin intersection because it's where 3 meridians meet that influence the kidneys, bladder, spleen, and reproductive organs. Research published in Evidence-Based Complementary and Alternative Medicine has documented that stimulation of Sanyinjiao significantly improves bladder control and reduces nocturia. Here's exactly how to stimulate it. Sit on the edge of your bed. Reach down to your right leg and locate the point 4 finger widths above your inner ankle bone, just behind the shin bone. You'll feel a slight depression or tender spot. Using your thumb, apply firm pressure directly into the point. The pressure should be strong, about 7 out of 10 intensity. Hold this pressure for 5 seconds while breathing slowly and deeply. Release, then repeat on your left leg for 5 seconds. That's 10 seconds total. You should feel a mild aching sensation radiating from the point, possibly extending up the inner leg. This indicates you've located the correct point and are applying adequate pressure. Component 2 is strategic pelvic floor contraction, taking 10 seconds. The pelvic floor muscles, when properly engaged, help support bladder control and reduce urgency. However, the technique for nighttime bladder control is different from standard Kegel exercises. Instead of just contracting and holding, you're going to do what's called a quick flick contraction pattern that resets the neuromuscular control of the bladder. Here's the exact technique. Stand next to your bed. Contract your pelvic floor muscles as if stopping urination. Hold the contraction for 2 seconds. Release completely for 1 second. Repeat this contract-release pattern rapidly 5 times. That's 5 quick contractions, each held for 2 seconds with 1 second rest between, totaling 15 seconds, but you can condense it to about 10 seconds once you get efficient. The quick flick pattern sends strong signals through the pudendal nerve to the spinal cord, essentially resetting the bladder control circuitry and reducing overactive bladder contractions. During sleep research in Neurourology and Urodynamics has shown that specific patterns of pelvic floor muscle activation can modulate bladder activity and reduce nocturia. Component 3 is strategic positioning for 10 seconds before lying down. This final component involves a specific body position that optimizes pelvic alignment, reduces pressure on the bladder, and promotes better drainage of any residual urine. Here's the technique. Stand at the side of your bed. Lean forward slightly from your hips, bending about 15 to 20 degrees. Gently contract your lower abdominal muscles as if trying to push out the last bit of urine. Hold this position and gentle contraction for 10 seconds while breathing normally. The forward lean and abdominal engagement encourage any residual urine in your bladder to drain more completely before you lie down, reducing the volume that accumulates during the night. After these 3 components, taking 30 seconds total, immediately lie down and go to sleep. Don't drink any fluids after the ritual. Don't use the bathroom again unless you have a strong urge. The ritual has prepared your bladder and pelvic floor for extended rest. Frank's complete protocol and results. Let me tell you exactly how Frank implemented this ritual and the additional strategies he combined with it for maximum effectiveness. Frank performed the 30-second ritual every single night immediately before lying down to sleep. He set a consistent bedtime of 10 p.m. to regulate his circadian rhythm. In addition to the bedtime ritual, he implemented several evidence-based supporting strategies. First, strategic fluid timing. Frank consumed most of his fluids before 5 p.m. He had 6 to 8 glasses of water throughout the day, but limited intake to small sips only after dinner. He stopped all fluids by 8 p.m., 2 hours before bedtime. This allowed his body to process and eliminate fluids before sleep while maintaining adequate overall hydration. Second, double voiding technique. Before starting the bedtime ritual, Frank used the bathroom and employed double voiding, urinating, waiting 30 seconds while performing gentle pelvic floor contractions, then attempting to urinate again to ensure his bladder was as empty as possible before bed. Research in the Journal of Urology shows that double voiding significantly reduces nighttime urination by decreasing residual urine volume. Third, elevation of legs in the evening. From 7 to 9 p.m., Frank elevated his legs by sitting in a recliner or lying down with legs propped on pillows. This promotes redistribution of fluid that pools in the legs during the day, encouraging urination before bedtime, rather than during sleep. Research in the International Journal of Urology has documented that evening leg elevation significantly reduces nocturia. Fourth, bladder-friendly diet avoiding irritants. Frank eliminated bladder irritants, including caffeine after noon, alcohol entirely, as it both irritates the bladder and acts as a diuretic, artificial sweeteners, and acidic foods in the evening. He focused on bladder-friendly foods, including vegetables, whole grains, lean proteins, and healthy fats. Fifth, bedroom optimization for easy bathroom access. Frank ensured a clear, well-lit path to the bathroom to reduce fall risk during nighttime trips that did occur. He kept a small nightlight in the bathroom. He also kept a urinal bottle next to the bed for emergency use, which reduced anxiety about making it to the bathroom in time. Within 3 days of implementing the complete protocol with a 30-second bedtime ritual as the centerpiece, Frank noticed significant improvement. His nighttime urination frequency decreased from 5 to 6 times to 4 times. Within 1 week, he was consistently waking 3 times per night. Within 2 weeks, he was down to 2 times per night, and occasionally just once. After 1 month, Frank was consistently waking once or twice per night, dramatically improved from his baseline of 5 to 6 times. His total sleep time increased from about 4 hours of fragmented sleep to 6 to 7 hours, with only 1 to 2 brief interruptions. His sleep quality improved substantially, as measured by feeling refreshed upon waking, improved energy throughout the day, better mood, and less irritability, and improved cognitive function and concentration. After 3 months, Frank's improvements had stabilized. He was averaging 1.5 nighttime urinations, waking once about 60% of nights, and twice about 40% of nights. He very rarely woke 3 times, and never woke more than 3 times. His quality of life had improved dramatically. His blood pressure normalized, likely related to improved sleep and reduced stress. He lost 12 pounds without specifically dieting, as better sleep normalized hormones affecting appetite and metabolism. His relationship with his wife improved as he was more pleasant and engaged. His overall health and vitality were substantially better. The science behind why this ritual works. Let me explain the specific mechanisms by which this 30-second ritual reduces nighttime urination. First, the Sanyinjiao acupressure point stimulation works through several pathways. Nerve pathway modulation occurs as the point is innervated by the posterior tibial nerve, and stimulation sends signals to the spinal cord that modulate bladder control circuitry. This is similar to the mechanism of posterior tibial nerve stimulation, an FDA-approved treatment for overactive bladder that involves electrical stimulation of this same nerve. Research in the Journal of Urology has shown that posterior tibial nerve stimulation significantly reduces urgency, frequency, and nocturia, and manual acupressure at Sanyinjiao stimulates the same nerve pathway. Hormonal regulation is another mechanism. Traditional Chinese medicine theory holds that the Sanyinjiao point influences kidney and bladder function, and modern research has found that stimulation of this point affects anti-diuretic hormone secretion, which regulates nighttime urine production. Research in evidence-based complementary and alternative medicine documented that acupuncture at Sanyinjiao normalized antidiuretic hormone patterns in patients with nocturia. Parasympathetic activation occurs as stimulation of this point enhances parasympathetic nervous system activity, which supports bladder relaxation and storage capacity while reducing overactive bladder contractions. Research in neurourology and urodynamics has shown that parasympathetic activation through various techniques improves bladder control. Second, the strategic pelvic floor contraction pattern resets neuromuscular control of the bladder. The quick flick contraction pattern, different from sustained holds, creates strong, rapid nerve signals that travel through the pudendal nerve to the sacral spinal cord where bladder control circuits are located. This barrage of signals essentially recalibrates the excitability of these circuits, raising the threshold for involuntary bladder contractions. Research in the International Urogynecology Journal has documented that specific patterns of pelvic floor muscle activation are more effective for reducing bladder overactivity than simple sustained contractions. The quick flick pattern also increases muscle fatigue slightly, and paradoxically, this temporary fatigue reduces muscle overactivity during sleep, as the muscles are less likely to contract inappropriately when mildly fatigued. Third, the forward lean and abdominal engagement position ensures more complete bladder emptying before lying down. When you lie flat with residual urine in your bladder, even 50 to 100 milliliters, this residual volume can trigger the urge to urinate within 1 to 2 hours. By ensuring more complete emptying before bed through strategic positioning and gentle abdominal pressure, you extend the time until your bladder reaches the volume that triggers waking. Research in the Journal of Urology has documented that reducing post-void residual volume significantly decreases nocturia frequency, supporting strategies for maximum effectiveness. While the 30-second ritual is powerful on its own, combining it with evidence-based supporting strategies maximizes effectiveness. First, optimize timing of medications. If you take diuretics for blood pressure or heart failure, taking them in the morning rather than evening reduces nighttime urine production. Discuss with your physician whether medication timing can be adjusted. Second, address sleep apnea if present. Sleep apnea causes frequent awakenings, and once awake, you notice bladder sensations that prompt urination. Research in Beat. JU International has shown that treating sleep apnea with CPAP significantly reduces nocturia. Frank had mild sleep apnea and started CPAP therapy, which contributed to his improvement. Third, consider supplementation with vitamin D and magnesium. As discussed in our previous video, vitamin D deficiency contributes to overactive bladder, and magnesium supports muscle relaxation, including bladder muscle. Frank optimized both, which supported his bladder control. Fourth, practice bladder training during the day. Gradually extending the time between bathroom visits during the day, working up to urinating every 3 to 4 hours, increases bladder capacity and reduces overall urgency, which carries over to nighttime. Fifth, manage chronic conditions. Diabetes, heart failure, and kidney disease all contribute to nocturia. Working with your physician to optimize management of these conditions reduces nighttime urination. Sixth, consider strategic afternoon naps. While excessive daytime sleep can worsen nighttime sleep, a strategic 20 to 30-minute nap in the early afternoon can reduce the sleep pressure that causes very deep sleep early in the night, which paradoxically can make it harder to wake up and consciously respond to bladder signals, sometimes resulting in bedwetting in severe cases. A balanced sleep pressure allows appropriate arousal when your bladder is full without creating excessive disruption. Important considerations and when to seek medical evaluation. While this 30-second ritual is safe and effective for most men, there are important considerations. First, nocturia can be a symptom of serious underlying conditions. If you have nocturia along with other concerning symptoms, including blood in urine, pain with urination, complete inability to urinate, significant daytime incontinence, or unexplained weight loss or other systemic symptoms, see a urologist immediately for comprehensive evaluation. Second, if you're waking up 5 or more times per night, particularly with large urine volumes each time, you may have nocturnal polyuria or an underlying condition like diabetes insipidus that requires specific medical treatment. The ritual can help, but addressing the underlying cause is essential. Third, The ritual works best for nocturia caused by overactive bladder, incomplete bladder emptying from prostate enlargement, and mild to moderate cases. Severe cases, or those caused by specific medical conditions, may require additional medical treatment. The ritual can complement medical treatment, but may not fully replace it in severe cases. Fourth, consistency is critical. The ritual must be performed every single night to maintain effectiveness. If you skip nights, the benefits diminish. Make it a non-negotiable part of your bedtime routine like brushing your teeth. Fifth, be patient. While Frank noticed improvement within 3 days, some men take 1 to 2 weeks to experience substantial benefit. The cumulative effects over weeks are what matter most. Commit to at least 4 weeks of consistent practice before concluding whether the ritual is effective for you. Sixth, if you're not experiencing significant improvement after 4 weeks of consistent practice combined with supporting strategies, consult a urologist for comprehensive evaluation. You may have underlying pathology requiring specific treatment, or you may benefit from additional interventions like formal bladder training, medications, or minimally invasive procedures. Your complete action plan. Here's your complete action plan to implement this 30-second bedtime ritual and stop nighttime urination. First, learn the 3 components of the ritual and practice them during the day until you can perform them smoothly. Sanyinjiao acupressure for 5 seconds per leg, quick flick pelvic floor contractions, 5 cycles of 2 seconds on, 1 second off, and forward lean with abdominal engagement for 10 seconds. Practice until it becomes automatic, taking about 30 seconds total. Second, establish a consistent bedtime and perform the ritual every night immediately before lying down to sleep. Third, implement strategic fluid timing by consuming most fluids before 5 p.m. and stopping fluids by 8 p.m., 2 hours before bed. Fourth, use double voiding technique. Urinate, wait 30 seconds. Urinate again to ensure complete emptying before the bedtime ritual. Fifth, elevate legs in the evening from 7 to 9 p.m. to promote fluid redistribution and urination before bed. Sixth, eliminate bladder irritants including caffeine after noon, alcohol, artificial sweeteners, and acidic foods in the evening. Seventh, optimize your bedroom for safe nighttime bathroom trips with clear paths and lighting. Eighth, track your results by keeping a simple log of how many times you wake to urinate each night. Review weekly to assess improvement. Ninth, be patient and consistent. Commit to at least 4 weeks of nightly practice. Most men notice improvement within 1 to 2 weeks, but full benefits may take 4 to 6 weeks. 10th, address any underlying conditions that may contribute to nocturia, including sleep apnea, diabetes, or heart failure. Work with your physician to optimize management. The 30-second bedtime ritual combining Sanyinjiao acupressure, strategic pelvic floor contractions, and forward lean positioning addresses multiple mechanisms causing nighttime urination, including bladder overactivity, incomplete emptying, nerve dysregulation, and hormonal imbalances. When combined with evidence-based supporting strategies, this simple ritual can dramatically reduce or eliminate the nighttime bathroom trips that are destroying your sleep and quality of life. Frank's story demonstrates what's possible: transformation from waking 5 to 6 times per night to waking once or twice, restoration of quality sleep and daytime energy, elimination of chronic fatigue and irritability, and dramatic improvement in overall health and quality of life, all from a 30-second ritual performed consistently every night. If nighttime urination is robbing you of sleep and vitality, you now have a scientifically grounded, practical solution that requires no medications, no expensive treatments, and only 30 seconds of your time each night. The question is whether you'll commit to implementing it consistently. Your sleep, your energy, your health, and your quality of life are waiting on the other side of this simple ritual. Thank you for watching Men's Health 365. If you found this helpful, please like, subscribe, and share with men who are suffering from nighttime urination and desperately need better sleep.